All right, I'm just going to go through some types of errors that you might see in your text as far as artifacts or processing errors. I just want to start with a definition of receptor exposure, and that's the amount of radiation which is striking the image receptor. The goal, obviously, is to expose the receptor to the right amount of radiation for the patient that you have and for the part that you have. Influencing factors for receptor exposure, primarily MAS is the controlling factor, and it's a direct relationship. So if you increase your MAS, you're going to increase your receptor exposure. KBP also has an effect on receptor exposure. It's mainly controlled by the 15% rule, but it's also a direct relationship. So if you increase KBP by 15%, you're also going to increase receptor exposure. Grids will actually be an indirect relationship because the goal of grids is to decrease the scatter radiation that's hitting the image receptor. So less x-rays hitting the image receptor, receptor exposure is going to go down. Filtration is also an indirect relationship. The filtration takes out some of those low energy x-ray photons, so again, less going through. Patient size, depending on if it's a really big patient may sort of attenuate a lot of those x-rays prior to getting to the receptor exposure, and vice versa. If they're very thin or they have something pathology-wise, might be a factor as well. And then SID, if you increase your SID, you're further away, you're going to decrease your receptor exposure. Over here on the right, I have pictures of underexposed versus overexposed. So the one on the left we call quantum model. You can see how fuzzy and grainy this image is. We're not getting great bone detail. It just looks really fuzzy overall. We call this having image noise or noisy. It's usually that you didn't use enough MAS. KBPs are usually pretty set per the part. MAS is the usual variable one depending on patient size. Can it come from not enough KBP? Yes, absolutely. But most of the time it's from not enough mass. The image here in the middle is sort of your ideal picture. Over here on the right is overexposed, or we call it image saturation. It's oversaturated with x-rays. You use too much technique, and it burned out all the soft tissue visualization here. So if you look to the one in the middle, you can see this nice soft tissue coming around the bone. On the right here, it's black. It's completely blackened out. You can't see it. It's burned out, and the bones are super white and overexposed. So this is saturation, and this is quantum model. Some processing errors that you might see. It usually depends on the histogram. And just a reminder about the histogram, it's the graphical representation on your image. It has an x-axis and a y-axis, so up and down here, just like all charts do. Each histogram, remember, is different for every body part. So where the gray values are for an abdomen won't be the same as a knee, something like that. If you process your image under the wrong anatomical part, it could cause an error or inaccurate image processing. Rescaling, the exposures are not always going to match perfectly. So processing under the actual histogram, using the rescaling option to the expected histogram. It's a process through the computer that's supposed to modify the histogram and make it look like the computer wants it to. It can essentially compensate for over and under exposures that are made by technologists, but it's not always going to be perfect. Lookup table, or LUT, it's the raw or digital image that has very little contrast here, processed through the lookup table, and look, magical desired brightness and contrast. Lookup table is an application. It's a mathematical formula to process the right amount of brightness and contrast. We don't need to do it or calculate it out as technologists, but a lookup table is the controlling factor for digital image contrast, not KBP. Collimation, there can also be collimation errors, and it can affect your EI number and overall quality of your image. So as you can see, if it's not the same on both sides, like this one up here, where you get this nice image, down here, they are most likely not lined up to their image receptor or table bucky or something. So they only have collimation on one side, resulting in this darkened image because it doesn't process well. So some terminology I do want you to watch out for when it talks about collimation. It might be talking about field of view, or FOV here. So if it's asking you about increasing field of view, that means you're increasing your light field, which gives you more scatter, decreases your image quality, and also increases patient dose. And more scatter can also increase your technologist dose. But increased field of view is different than increased collimation. Increasing collimation is actually collimating in tighter, bringing the leaves of your collimator in, making your field smaller. Decreasing scatter increases your image quality and decreases patient dose. So watch that terminology on collimation questions. Image receptor error options. A pixel malfunction, as you can see this little white dot here, it might be a dead or a damaged pixel that's going to show up white here. These white lines coming through here might be a damaged receptor. Someone might have dropped it, usually physical damage, or sometimes people, it gets liquid inside it from cleaning or something, but usually someone has dropped the expensive cassette. The two other images that I have here are showing you ghost images, and these are usually on CR only. They're called ghost images, and it happens as a result of not being processed or incomplete erasing on the CR processor. Positioning errors that you could see, these are pretty obvious, and I know we've all done them, but tube position, you might have the wrong angle, you might have the wrong direction. Part position, it could be rotated, the part could be tilt, there could be elongation or foreshortening, magnification, right? If you increase OID, you're going to be magnified. Receptor position errors, your cassette or grid could be tilted. Collimation errors, the collimation should always be symmetrical, so watch your field of view, make sure you're collimating to the part. Identification errors, it could be the wrong patient, the wrong part, the wrong side, wrong marker, possibly wrong annotation or wrong time annotated on the image. Those could all be incorrect ID markers, possibly.